Morning, Olga. Hope you are well. And thank you very much for joining the conversation today. It's a real pleasure to have you here. Could we actually start by just kind of introducing yourself a little bit? Tell me a little bit about your experience and how you come to be working in digital health.
Hi, Andy. First, thank you very much for inviting me. It's my pleasure to be here with you. My name is Olga. I'm a co-founder of BeSure Healthcare. I'm a healthcare transformator and experienced entrepreneur with both health tech and insurance background. I'm graduated from Technical University, and in the beginning of my career, I worked for insurance company. So my first healthcare transformation project goes from actually my first postgraduate job.
Excellent. So, would it be fair to say that insurance is where your passion for healthcare began, or is there more to it than that?
Yes, absolutely. Because I'm originally from Ukraine, as I told before, and about 20 years ago, I've launched an insurance transformation project in Ukraine, and we have completely changed the existing and traditional approach. In a year, we had more than 10,000 of clients, about 5 healthcare providers, and we even have opened our own private clinic. Yeah, so I've understood that maybe I should focus on healthcare transformation and try to use technology for creating better healthcare environment.
Yeah, wow, that's amazing. That's amazing. So, you obviously kind of believe very strongly in the role of digital to improve healthcare. Do you want to elaborate on that a little bit? What role do you think digital should play in the future?
Actually, I don't think that digital health or AI should exclude doctors from the chain. You know what I mean? I think that our goal is to create a relevant environment where healthcare professionals and general practitioners could make better decisions, more precise and more accurate.
In a way, it becomes more like it's a team kind of game where, you know, what we're talking about is better quality insight that leads to better outcomes. Is that kind of what you're saying?
Okay, I think that the key of better outcomes lies in healthcare professional satisfaction field. Mm-hmm. So we have to improve environment for professionals. We have to improve quality of data and existent guidelines and so on. And of course, we have to improve diagnostic, and all these things will give an opportunity to predict, to validate, and to manage diseases more effectively. In my mind, the main goal of digital health is to improve clinical decision support. Yeah, to provide clinical decision support for healthcare professionals. So it's not about excluding doctors. It's about improving their workflow. Yeah.
So obviously we've seen I can talk about it anecdotally. Through the pandemic, we can see that, you know, healthcare has suddenly become more digital. But specifically, I guess, you know, it's been focused around telehealth and the idea that, you know, simple kind of conversations, whether it's, you know, at a diagnosis or during treatment or during ongoing treatment, those conversations can be facilitated by, you know, video conversations on Zoom and tools like the ones we're using right now. How do you think of the effect of the pandemic on the healthcare industry? And do you think it has accelerated digital health, or is there something more specific that you want to kind of call out?
Okay, of course, I have to say that COVID-19 is a very good driver of healthcare transformation, but price is too high. I think that telehealth, telehealth is really improved, but we have to work more and more on real digital health implementation, starting from remote diagnostics, starting from risk measurement, and finishing by health outcomes measurement. So it's not only about telehealth, it's not only about using Zoom for consultation. It's about increasing a level of digital adoption on all stages of healthcare management, on all stages of disease management, from primary diagnostic to patient's outcomes.
I would agree. I think what we're seeing is less of the kind of latter, the more sophisticated use of the data. It's more about the simple use of kind of telehealth solutions, at least as I kind of see it right now. But I guess that's a good point. It's a good point to talk about your company, to understand what your vision is and how you feel that BeSure Healthcare can contribute to that more informed healthcare environment where digital is playing a much fuller role. Do you want to just, can you introduce the company to us, Olga?
Yes, of course, with a pleasure. We develop BeSure Online. It's our primary product. BeSure Online is a digital health platform for stroke prevention. It's a collaborative solution. We get data from wearable devices. We provide real-time analysis of leading health indicators. We provide AI-based clinical decision support with feedback for users, with decreasing and measurement risk of acute stroke event. And also we collect and analyze data for insurance companies. As a collaborative solution, we create an additional value for all our users. Our patients feel themselves more cared, and they better follow treatment and prevention plans. Healthcare providers could serve more patients at the same time and adjust treatment and prevention plans more effectively. And healthcare payers could, of course, reduce healthcare costs, but also they could measure health outcomes and use this information for creating new health plans. And as about our vision, we are in piloting stage now, and our product is launched partially. Right now, we could provide real-time analysis. We could provide distance patients monitoring. We use specific wearable device sense band for continuously ECG monitoring without any interaction with patient. And our vision is, of course, 5 years from now to be a leading digital health company with millions of connected users, with thousands of connected healthcare professionals, and with maybe hundreds of saved lives.
Wow, that would be amazing. Just talk to me very quickly about the customer, the route to market. Who are you targeting in order to kind of maximize the distribution of the platform and adoption of it?
Okay, so of course we believe in prevention, and in my mind, primary care should focus on disease prevention, whether treatment and management. That's why we, of course, closely collaborate with healthcare professionals, with medical universities, and even small clinics and GPs. We ask them what they really want, what they really need, what are their gaps. We try to identify the main gaps of stroke prevention in primary care. But also, we would like to create a product, to launch a product that to be easily adopted and localized and easily implemented in primary care level. That's why like we have chosen a very soft way of collaboration with healthcare payers. So we also ask them to join our piloting projects. We ask them to collaborate from the beginning. We ask why they would like to pay for prevention and what actually they are waiting for our platform, our solution, and so on. And of course, we care about users. We collaborate with end user organizations, with the Living Lab. We had maybe 100 of interviews. We try to make our product easy to use and very simple. Because yeah, we understand that our target users are aging patients and they are not highly adopted, and it's maybe a little bit difficult for them to implement all this solution. That's why we try to educate them in the same time and create our interface based on their feedback.
Yeah, I think there are a number of obstacles, in the way to kind of wide adoption, right? I think that nod was full agreement. Whether you look at your core demographic in terms of the kind of the end users, the patients, you look at the healthcare institutions, and I guess, I mean, your grand ambition is going to be international, right? It's not just within Holland. So you have the different systems to navigate. And it's getting it your solution kind of instituted within those different kind of processes. What do you think of as what do you think the biggest obstacles are to wide adoption of your solution?
Okay, I think that the biggest obstacle is localization, because stroke is a social disease, yeah, and stroke prevention will not be successful without changing patients' behavior. And a stroke prevention protocol should be personalized and adapted to local, not only local healthcare standards, but also adapted to local lifestyle and patients' behavior. Because stroke prevention is quite different in, for example, Mediterranean area and in Northern Europe. That's why we have partners, close partners from all over the Europe, and we collaborate with them in terms of stroke prevention protocol personalization, but based on local environment. I mean, climate, lifestyle, diet, healthcare standards, primary care standards, and so on.
Interestingly, I kind of on this interview, in fact, I spoke to an Italian cardiologist working in Spain. I mentioned the iWatch specifically, or Apple Watch, as I think it's called. I don't know why I've given it a new name. And he welcomed the idea of kind of more data, more insight, but also, was kind of, I guess, puzzled a little bit by how it's all going to fit together. And he mentioned the idea of perhaps having a data analyst sat in the hospital, or the hospital ecosystem and network, who would actually look at the data coming in, and perhaps even triage that according to the meaning of it in relation to a patient or specific patient cohorts. that, I think, to get there would represent, kind of massive progress. Do you see a similar solution? Do you see similar kind of blockers to wider adoption? How do you think of, the use of that data by hospitals and healthcare systems?
First of all, if we talk about AI for healthcare, the main obstacles are data quality and data interoperability, of course, because if you would like to have a high quality and clear data for make forecasts, for make prediction and real-time diagnostics, we have to train our machine learning algorithms on very clear and verified data, and it's a problem. And also interoperability is a problem as well, because sometimes we have a lot of issues in terms of getting right data from different data sets. Yes, because we have to sign agreement with all data owners and so on. If we talk about adoption level, the main obstacle is local education and difference between piloting world, and real world, because a lot of health tech entrepreneurs, such as startups and SMEs, also try to launch piloting projects with huge university clinics. And a lot of these projects are successful, but when companies try to transform and scale their solution, when they try to localize and adopt their solution for primary care, for local clinics, for small clinics, they usually meet a lot of obstacles, because the level of technical adoption, of digital health adoption is quite different in big university clinics and in ordinary clinics. That's why if you would like to make a solution for primary care, we have to pilot with primary care first of all. But from other side, we have to validate our solution with the big university clinics, because it will increase the level of trust. But it's much more about implementation, adoption, and technology. The next question is concept itself. First of all, we have to decide what we are going to do with our digital health solutions. I mean, not our own solution, but all digital health solution. Would we like to exclude doctor from the process, or just just help to operate more precisely and effectively? And if we clearly understand our goal, if we clearly validate and understand our concept, okay, solution could be successful. But if we would like to, for example, reduce the level of doctor's participation, like in patient's life, and in the same time try to collaborate with healthcare professionals, I think it's really quite different, difficult and different question. So concept is first, and technology second.
Yeah, it's complicated, as I think you've kind of very well demonstrated. So that, I mean, maybe at a more philosophical level, if there was one thing that you could do to improve healthcare, and obviously you sit, concerned with stroke care, and within that kind of that sits within the kind of broader category of cardiology, which is itself a massive contributor to the overall kind of death count across the planet. What would there be one thing that you would do to improve health?
Okay, it's a good question, and I absolutely believe in prevention. Right. So I think what we really should do is to transform primary care from health management to healthcare prevention, especially when we talk about cardiac disease.
Yeah, I don't know what it's like in Holland, you know, or the kind of the approach within the healthcare system there, but from speaking from the UK perspective, it's very much about treatment. It's not about prevention, and that is one of the biggest things that needs to change. I completely agree. There's very little attention paid to.
Absolutely.
Yeah.
Yes, absolutely. About 30% of acute cardiac event could be prevented. I think that if we really would like to improve this field, we have to focus on prevention, and we have to make prevention not only, we have to improve not only prevention quality, but also accessibility. So it's about collaboration with healthcare payers.
And education as well?
Yes, patients' education, of course.
Yeah, absolutely. Absolutely. Fantastic. All right, Olga, I'm going to wrap it up there. I'm sure you have a ton of things to do to keep pushing your business forward. So I'd just like to thank you very much indeed for your time. It was really interesting to talk to you today. So thank you for being generous with your time. Is there anything you want to say before we wrap up?
Thank you very much for inviting me, and I wish all healthcare entrepreneurs to go forward, to try and to actually move the process. Yeah, not only be a part, yes, we should not only be a part of healthcare transformation, but also we could drive it. So let's do it.
Perfect.
Thank you. Thank you very much.
Thank you, Olga. Thank you so much for your time.